This PowerPoint contains few common questions and answers that frequently asked in NCLEX board exam, and it gives a tips on how to answer the question that are likely to be asked in NCLEX board. It is board review questions. The question number 1, a client with type 1 diabetes and must undergo the bowel resection in the morning. How should the nurse proceed while caring for him on the morning of surgery? So examiner asking this question who have a type 1 diabetes. Number 1, administer half of the client typical morning insulin dose as ordered. Number 2, administer an oral anti-diabetics agents as ordered. Number 3, administer an IV insulin infusion as ordered. Number 4, administer the client's normal daily dose of insulin as ordered. The correct answer, administer half of the client's typical morning insulin dose as ordered. So we know that type 1 diabetes treated by insulin and type 2 usually treated by oral anti-diabetic medication. So here we go and little bit talk about type 1 and type 2 diabetes. So type 1, it is insulin dependent diabetes mellitus. But type 2, non-insulin dependent diabetes mellitus. What does it mean? Type 1 treated must be by insulin, but type 2, it is not necessary. We always try first oral anti-diabetic medication. If oral anti-diabetic medication is not enough to control type 2, then we can add insulin. So type 1 say the most prevalence in the children and non-obese adult. So type 1 is the most common in the children or adolescents. We call juvenile diabetes. And there is little or no insulin production by beta cell or islets of Langerhans. So in the pancreas, there are two types of cell, beta cell and alpha cell. Beta cell produce insulin, alpha cell produce glucagon. So if beta cell do not produce insulin, or beta cell produce insulin, but our tissue does not use it or resistant, right? It is very common in type 1 diabetes. Whereas the type 2, it is most common in obese adult older than 40 years age. And there is a partial decrease of insulin production or the cell resist to insulin. The insulin is required for transport of glucose across the cell membrane. So we call insulin is important for glucose metabolism. Decrease the insulin result in increase the glucose level, so-called hyperglycemia. In this question, answer admin half of the client's typical morning insulin dose is ordered. Why we choose this is the answer. Rationale said, if the nurse administer the client's normal daily dose of insulin while he is on nothing by mouth status before surgery, and he will experience hypoglycemia if he takes full doses. Therefore, the nurse should administer half of the daily insulin dose as ordered. Oral anti-diabetic agents are not effective for type 1 diabetes. IV insulin infusion are not necessary to manage the blood glucose levels in the client undergoing the routine surgery. Here we are going to focus few more information about type 1 and type 2 diabetes. So clinical manifestation, type 1 and type 2. If type 1 complication, particularly patient turns to develop either hypoglycemia or diabetic ketoacidosis. If type 2 patient has a complication, usually develop hyperglycemic, hyperosmolar, non-ketotic coma. Usually NCLEX board asks a question, in case of diabetic ketoacidosis or DKA, what are the patterns of respiration? It is rapid and deep. Shortness of breath, we call Kussmaul respiration. Let me recap it. If NCLEX board asks a question, in case of diabetic ketoacidosis or type 1 diabetic complication, what type of respiration? We call Kussmaul respiration. What are the nature of Kussmaul respiration? It is rapid and deep respiration. In case of type 2, where is the hyperglycemic, hyperosmolar, non-ketotic coma, the respiration is rapid and deep, right? But absence of Kussmaul respiration. If patient have diabetic ketoacidosis, they have a characteristic breath odor. It is called fruity due to the acetone, but it is absence in case of type 2 diabetes complication. And what are the treatment? If patient have a diabetic ketoacidosis, basically we admit IV fluid and insulin. If the patient had type 2 complication or hyperglycemic, hyperosmolar, non-ketotic coma, we give them IV fluid and or insulin, right? Now question 2, the A nurse explained to a client with thyroid disease that the thyroid gland normally produce. So out of 4, number 1, iodine and thyroid stimulating hormone, shortly called TSH. Number 2, thyrotropin releasing hormone, TRH, and TSH means thyroid stimulating hormone. Number 3, TSH, T3, and calcitonin. Number 4, T3, T4, and calcitonin. So your patient have a thyroid disease. Now examiner asking, thyroid gland produce which 3 hormones? The correct answer is T3, T4, and calcitonin. T3, other name is called triiodothyronine, and T4, other name is called thyroxine. So rationals say the thyroid gland normally produces thyroid hormone T3, T4, and calcitonin. The pituitary gland produces TSH to regulate the thyroid gland, and hypothalamus, the gland produces the TRH, means thyrotropin releasing hormone. So we can see this is a picture. This picture basically showing the negative feedback, but here the picture I'm going to explain. This is the anatomy of the brain, and this one is called hypothalamus, and this is the pituitary. Hypothalamus secrete the thyroid releasing hormone, and this one act on pituitary, and pituitary secrete TSH, right? And this TSH, thyroid stimulating hormone, act on the thyroid gland and secrete T3, T4. Here we can see, let me explain one more time. Hypothalamus in the brain secrete thyroid releasing hormone TRH, and it is stimulate the anterior pituitary gland, and anterior pituitary gland secrete thyroid stimulating hormone TSH, and it works over the thyroid gland, and thyroid gland secrete T3, T4 thyroid hormone. The major function of thyroid hormone, they increase metabolism, they promote growth and development. If T3 and T4 go up more than normal level, we call hyperthyroidism, and patient develop exophthalmos, like bulging, swollen eye, and in this picture you can see enlarged thyroid glands. If the T3, T4 is go down, patient develop hypothyroidism. And in this picture, we can see the goiter, right? And if you do the clinical observation or examination to observe the thyroid gland and find related sign like increase the reflexes, tremor, and eye change, right? How you diagnosed it? By ultrasound to detect the enlargement of thyroid glands and surrounding structure. Next question. A nurse is providing care for a pregnant client. The client asks the nurse how she can best deal with her fatigue. The nurse should instruct her to, number one, take sleeping pill for a restful night sleep. Number two, try to get more rest by going to bed early. Number three, take the prenatal vitamin. Number four, tell her not to worry because the fatigue will go away soon. So your patient are pregnant, asking you how to avoid or best deal with fatigue. The correct answer is try to get more rest by going to bed early. Rationale: the client should listen to the body's way of telling her that she needs more rest and try to going to bed early. Sleeping pills should not be consumed prenatally because they can very adverse effect on the fetus. Vitamins would not take away fatigue. False reassurance is inappropriate and does not help the client deal with fatigue now. Here a table we can see what are the normal pregnancy discomfort in each trimester. So this is the list of discomfort, but it is normal. So every healthcare provider must know it is normal. You educate the patient that it is normal. In the first trimester, nausea, vomiting, increase the frequency of urine, breast tingling sensation, right? Also, excessive splitting. In second trimester, patient develop constipation, educate them intake of fiber and water, heartburn, pigmentations. Linea nigra becomes prominent. So in this picture, we can see the line along the umbilicus to pubis symphysis. It is normal. Leg clamps are normal if no suggestions of our Hoffman sign. Hoffman sign, if positive, it indicates deep vein thrombosis. In case of third trimester, leg cramp, hemorrhoid, back pain, also increase the urinary frequencies. But what are the signs is danger? We need to report to the healthcare provider. So number one, vaginal bleeding. So during the pregnancy, mother must be amenorrheic or no menstruation, no bleeding. If bleeding is occurred, this is the danger sign. Abdominal pain, epigastric pain, visual disturbance. It is the sign of preeclampsia or eclampsia. Severe persistent headache, change in the fetal movement after quickening, means first movement of the baby. Painful or burning urination indicate UTI. Edema on the face, feet, and hands. Sudden rush of the fluid or elevated temperature above 101 indicate infection. Persistent vomiting after the first trimester. Also, absence of the fetal movement after quickening. It is important immediate talk to the doctor. Next question. A nurse is caring for a client with a central venous pressure of 4 mm of mercury. Which nursing intervention is appropriate? Number one, call the physician and obtain the order for a fluid bolus. And also, number two, they said, we gather the equipment and take another reading. And number three, call the physician and obtain the order for diuretics, right? And also number four, continue monitor the client as order. So examiner asking this question about central venous pressure or CVP. What is central venous pressure? Right? So central venous pressure is the blood pressure in the vena cava of the heart. And CVP reflect the amount of the blood returning to the heart and the ability of the heart to pump the blood back into arterial system. Central venous pressure is often a good approximation of the right arterial pressure, although the two terms are not identical, as a pressure difference can sometimes exist between the vena cava and right atrium. What we need to know for the board exam. In this picture, we can see the jugular venous pressure. We can measure it over there. So correct answer said, continue monitor the client is ordered. Because the central venous pressure is 4, means it is inside the normal range. So normal CVP range for 3 to 4 millimeter of mercury. The nurse does not need to take any action other than to monitor the client. It is not necessary to gather the equipment or calling a physician and obtaining an order for fluid bolus would be an appropriate intervention if the client has a central venous pressure less than 3 millimeter of mercury. Administering a diuretics would be appropriate if the client has excreted the fluid as demonstrated by a CVP greater than 7 millimeter of mercury. Here we can see the central venous pressure monitoring. The normal it is 2 to 6 millimeter of mercury. Some books said 2 to 8 millimeter of mercury. And here we say 3 to 7 millimeter of mercury. It is good if you remember all of them. Any one you will get in NCLEX board. So central line or pulmonary artery catheter pressure. So central venous pressure is elevated when overhydration, increase in venous return, or heart failure or pulmonary artery stenosis. What are the medical conditions when central venous decrease? When hypovolemic shock occurs, like hemorrhage, or because of hemorrhage, fluid shift or dehydration. Let me recap it. What are the medical conditions when central venous pressure go down? In case of hypovolemia, or if the venous return decrease, management is give them IV fluid. What medical condition when central venous pressure increase? If overhydration, or if the venous return increase, or right-sided heart failure. Next question here. A nurse is preparing the daily care plan for a client with newly diagnosed diabetes mellitus. The priority of nursing concern for this client should be: number 1, monitor blood glucose every 4 hours as needed, or checking for presence of ketone with each voyage. Number 3, providing the client education at every opportunities, and also administer insulin routinely and as needed via sliding scale. The correct answer said providing the client education at every opportunities. The key point in this question, the prepare the daily care plan, who is newly diagnosed. So education, reinforce, teaching is most important. The rationale, the nurse should use routine care responsibilities as teaching opportunity with the intention of preparing the client to understand and eventually manage his disease. Monitoring blood glucose, checking for presence of ketone, also administer insulin are important when the caring for a client with diabetes, but they are not the priorities of care, right? So questions a priority of nursing consult for the client who is newly diagnosed. Next question here. Why should an infant will be quiet and seated in an upright position when the nurse assesses for his fontanel, right? So out of 4, which one is the answer? Number 1, a mother will have less trouble holding a quiet or upright infant. Number 2, fontanel may or making assessment more difficult. Receipt or the infant can breathe more easily when he is sitting up. Number 4, lying down or crying can cause the fontanel to bulge. So fontanel, the correct answer is lying down and crying can cause the fontanel to bulging outside. So in this picture, we can see the skull. This is anterior fontanel, where the 4 bones is meeting together, 2 frontal bones, 2 parietal bones. And this is called posterior fontanels, where the 3 bones meeting point, 2 parietal and occipital bones. So it is very important. NCLEX board sometimes asks the question. So a fontanel is a soft spot. This is the soft spot. A baby, I mean, it is an anatomical feature of the baby's skull. A baby has usually 6 fontanel that consist of membranous tissue in the area where the certain adult skull sutures are found. And fontanel allow the skull to pass through the birth canal and also provide a means of expression as the brain growth. So number 4 is the answer. Why? So when lying down and crying can cause the fontanel to bulge and making the nurse assessment inaccurate. The nurse should sit the child upright and try to keep him clean and quiet for accurate measurement. The fontanel should look almost flushy with the skull, and the nurse should observe slightly pulsation. The fontanel should feel soft and either flat or slightly distended. This is the picture, anterior fontanel, posterior fontanel. NCLEX board asks 2 questions. When anterior fontanel closing and when posterior fontanel closing. At birth, the anterior and posterior fontanel are usually present. Posterior fontanel close early, few weeks of age. Anterior fontanel normally closed by 12 to 18 months of age. Early closure of fontanel indicate craniostenosis due to the premature closure of the skull suture. Next question. A depressed client in the psychiatric unit has not been getting adequate rest and sleep. To encourage the restful sleep at night, the nurse should do what? This question about the psychiatry, mood adjustment, and mental disorder. Number 1, talk with the client for a long time at night to reduce his anxiety. Encourage the environmental stimulation during the evening. You say encouraging stimulation. No. Number two, gently but firmly set limit on how much time the client spend in bed during the day. So it is good always follow a routine work, daily same work. Number four, encourage the client to take an anti-anxiety agents as need at the bedtime. The correct answers say gently but firmly set limit on how much time the client spends in bed during the day. Rational, setting limit on how much time the client may spend in bed and what time the client must get up in the morning. Let him know what is expected of him while conveying genuine concern for him. Talking with the client for a long time at night would interfere with the sleep and give the client attention for not sleeping. Encouraging environmental stimulation in the evening would discourage the rest and sleep at night. While most anti-anxiety agents have sedating adverse effect, and they are not intended for use as sleep-induced agents. Next question. A nurse encourages a client with a immunological disorder and to eat a nutritional balanced diet to promote optimal immunological function. So which snacks have a greatest probability of stimulating the immunities? So which food is good for stimulating immunities? Number one, raisin and carrot sticks, potato chips and chocolate milkshake. Number three, fruit salad and mineral waters. And number four, they said the crackers, right? And correct answer is potato chips and chocolate milkshakes. The rationale say a diet containing excessive fat, such as that found in potato chips and milkshakes, seems to contribute to autoimmunities. Overreaction of the body, again, constituent of its own tissues. Raisin, carrot, fruits, minerals, crackers are the snacks containing adequate amount of vitamin E, zinc, carotene, which are beneficial for the body. But potato chips and chocolate milk shake is good for autoimmunity. It stimulates autoimmunities. There are 9 foods what is bolstering the immunities, like oat, mushroom, pumpkin seed, sweet potatoes, garlic, ginger, and citrus fruits and walnut. Next question. Which nursing diagnosis takes highest priorities for a child in the early stage of brain recovery? Sorry, burn recovery. So if anybody undergo to the burn, so what are the most priorities? Number one, risks for infection. Number two, impaired physical mobilities. Number three, disturbed body image. Number four, constipation. All is important, but which one is life-threatening? Which is the most priority to prevent first, right? Definitely risks for the infection. So infection prevention is the first priorities, right? If patient has any physical immobility, you can correct it later physiotherapy, even some surgical management. Body image, life-saving is important that body image. Constipation, you can prevent by fiber intake and water. So reference say, because infection is a serious risk for the client in the early stage of burn recovery, a diagnosis of the risk for infection takes the highest priorities. Diagnosis of impaired physical mobilities or disturbed body image on constipation may be relevant, but take lower priority at this time. Next question. An early client asks the nurse how to treat chronic constipation and what are the best recommendations the nurse can make. Number one, take a mild laxatives such as magnesium citrate when necessary. But laxative for a long time is not a good choice. Number two, take a stool softener such as docosahexaene sodium. Or number three, admin tap water enema weekly. Number four, administer a phosphosoda enema when necessary. The correct answer, take a stool softener such as docosahexaene sodium daily. So rationale why we choose the docosahexaene. Stool softener taken daily promote absorption of liquid into the stool or creating a softener mass. They may be taken on a daily basis without developing a dependency. Dependency is an adverse effect of daily laxatives use, right? So we do not use the magnesium citrate. Enema used daily or on a frequent basis can also lead to dependency of the bowel on external source of stimulations. So that answer here, we're going to talk about a little bit more about laxatives. Laxatives we use to increase the bowel evacuation. You use to treat the constipation. The drug's name, types, and common side effect. Bulk forming agents, usually we use metamocil or psyllium, right? This is the metamocil or psyllium, right? Stool softener we call docosahexaene. Lubricants, mineral oil. Hydrating agents, we can use magnesium citrate, magnesium hydroxide, or we call milk of magnesia or magnesium sulfate. Hyperosmotic agents like lactulose or sorbitol, or stimulant irritant, we use Sina or bisacodyl. So here's something very important every student must know about the laxatives we call nursing implications. So monitor for electrolytes. So if your patient need to take laxatives, it is important to monitor electrolyte imbalance. Metamocil, take with 8 ounces of water. This is metamocil or psyllium. Lactulose may be used to decrease ammonia level in the client with hepatic encephalopathy. If liver does not work, the waste product, so-called ammonia produce, and ammonia enter into the brain and causes the confusion, right? So if patient has hepatic encephalopathy, it is good to give them lactulose. And this is the question NCLEX board frequently asks. And also, we could educate the patient if they have any kind of rectal bleeding. It is important inform the healthcare provider. And here the few board review question and answer we discuss. It will help you to get your license.